How does genetics impact colorectal cancer risk? Genetics can play a big role in how likely someone is to develop colorectal cancer. Some people inherit gene mutations that increase their risk by causing abnormal cell growth in the colon or rectum. These inherited factors can be passed down through families, leading to hereditary cancer syndromes that make colorectal cancer more common in certain families than in the general population. The most well-known inherited syndromes linked to colorectal cancer are Lynch syndrome and familial adenomatous polyposis. Lynch syndrome results from mutations in mismatch repair genes that normally help fix DNA errors. When these genes don't work properly, errors build up in cells, leading to increased cancer risk. People with Lynch syndrome can have up to an 80% chance of developing colorectal cancer during their lifetime. Familial adenomatous polyposis is caused by mutations in the APC gene. It leads to the growth of hundreds or even thousands of polyps in the colon and rectum, often starting in teenage years. If not treated, nearly all individuals with this condition will develop colorectal cancer by age 40. There are other less common syndromes, like mutation-associated polyposis and hereditary mixed polyposis syndrome, which involve different genetic changes but also increase risk. Having a family history of colorectal cancer or polyps, especially if cancers occurred at a young age or there are multiple primary cancers in the family, suggests a genetic predisposition. Genetic testing can help identify if someone carries gene mutations linked to increased risk. Doctors often use prediction models to decide who should get tested. Studies show that about 5% of colorectal cancers are due to inherited gene mutations, but recent research suggests that up to 1 in 6 patients may carry inherited mutations that might be missed by standard screening guidelines. Colorectal cancer develops through different genetic pathways, including chromosomal instability, microsatellite instability, and CpG island methylator phenotype. Mutations in genes like APC, BRAF, and mismatch repair genes influence these pathways and affect how tumors form and grow. Understanding your genetic risk can help guide personalized screening plans. For example, high-risk individuals might need earlier or more frequent colonoscopies. In some cases, preventive surgery, like removing polyps or parts of the colon in syndromes like familial adenomatous polyposis, can greatly reduce cancer risk. Genetic counseling is an important step to help people understand their risk and make informed decisions about testing and management. In summary, genetics impacts colorectal cancer risk by creating inherited conditions caused by specific gene mutations that interfere with normal cell regulation in the colon and rectum. Recognizing these genetic factors allows for better risk assessment, early detection, and prevention strategies. If you have concerns about your family history or risk factors, talking to a healthcare professional or genetic counselor can provide personalized guidance. Always remember that individual risk varies, and medical advice tailored to your situation is essential for optimal colon health.